In terms of the environment that we were working in back then, I think that it's safe to say that it was, I won't say easier, but it was more realistic to expect that in Seattle we could get AIDS-related projects up and running faster and with fewer complications than some other metropolitan areas in the country. And the Centers for Disease Control viewed us that way too, because they wanted to get their demonstration projects up and running, and they were running into problems all over the country, and Dallas and Denver and Long Beach and other places where they were trying to set up these projects. And we were able to get a clinic and get people recruited in long-term studies more quickly than the other cities. And I personally think that some of that had to do with just the environment in Seattle prior to the outbreak of AIDS. Now, looking back to the late 70s, a very important moment in Seattle's history was the Initiative 13 campaign, the campaign against Initiative 13, which would have repealed the City of Seattle's open housing, fair housing and employment ordinance. So many people in the gay community and so many allies of the gay community got involved in that effort, including a lot of health workers, including organizations like the ACLU, and the Dorian Group was very active in that effort. I think that the publicity around that effort and the success of the effort was so great that Seattle was viewed as, you know, one of the middle-sized metropolitan areas in the country where not only was it becoming safe or safer to be a gay or lesbian person, but organizations could thrive and organizations could be created that might have been difficult to create in other environments and in other communities. So I think that a lot of that early civil rights related groundwork that was laid by the people who worked on the campaign against Initiative 13 and all the allies made Seattle a better place to try to do innovative work around AIDS once the epidemic finally struck here. And looking back, I'd say it wasn't easy, but I can certainly think of other municipal areas around the country where it would have been much, much more difficult to get programs and organizations off the ground.